Other neurological disorders include brain tumors, stroke, head trauma, open head injury, and closed head injury. In brain tumors, the symptoms depend on location. In children, they usually occur in the brainstem or cerebellum. In adults, typically in the cerebral cortex. The first sign of a stroke is depression, anxiety, or psychological problems. Other symptoms include dull headaches, seizures, nausea, vision or hearing changes, and neurological issues. A stroke is a sudden severe blood flow to the brain and can result from an embolism or hemorrhage. Most occur in the middle cerebral artery. They can cause hemiplegia, sensory loss, and dementia. A frequent outcome of stroke is impaired circulation of the cerebrospinal fluid. It can cause dementia, gait disturbance, and incontinence. 50% of stroke victims die soon after the stroke occurs. 10% of the rest fully recover. The greatest improvement after a stroke is during the first 6 months, and physical symptoms improve more quickly than cognitive symptoms. Head trauma is the most common cause of brain damage in people under 40. Head trauma can be an open head or a closed head injury. In an open head injury, the skull is penetrated. Many people do not lose consciousness, and symptoms are usually local and resolve quickly. A closed head injury causes more widespread damage and is usually followed by loss of consciousness, then amnesia. The duration of anterograde amnesia is the best predictor of recovery. Most victims recover within 6 to 9 months. Some symptoms like personality and motor disturbances can persist. Neurological disorders, motor control disorders, Huntington's chorea, and Parkinson's disease. Huntington's chorea causes cognitive deterioration, personality changes, and movement abnormalities, and is a genetically transmitted disease that affects half of offspring. Symptoms start at ages 30 to 50 years. Initial symptoms are affective, then forgetful, clumsy, and fidgety. Later, chorea and anthetosis can happen, and tics, speech, and motor declines. The suicide risk is high among young patients. There is a reduced volume in basal ganglia and metabolic brain activity. Parkinson's disease is a degenerative brain disorder causing movement abnormalities. Symptoms include tremor, muscle rigidity, involuntary movements, posture and equilibrium problems, and akinesia. 40% of Parkinson's sufferers exhibit depression and have reduced levels of serotonin. Parkinson's disease is a degeneration of dopamine-producing cells in the substantia nigra. Drugs that increase brain dopamine can help symptoms. Psychopharmacology, antidepressants, tricyclics, SSRIs, and MAOIs. Antidepressants take 2 to 6 weeks to work and don't work for everyone. They are not drugs of abuse. There are 3 classes of antidepressants: tricyclics, SSRIs, and MAOIs. Tricyclic medications include imipramine or trofanil, clomipramine or anafranil, and amitriptyline or Elavil. They block the reuptake of serotonin and norep at the synapse. They are best for vegetative symptoms, including appetite and sleep issues, and psychomotor retardation. They're also good for panic, agoraphobia, and OCD. Side effects include dry mouth, constipation, urinary retention, blurred vision, and nasal congestion. An overdose produces cardiac arrhythmia and sudden death. Most side effects are eliminated at lower dosages. Overdoses of tricyclics and MAOIs can cause convulsions, hypertension, and death. They are not for suicidal patients. SSRI medications include fluoxetine, or Prozac, sertraline, or Zoloft, and paroxetine, or Paxil. Prozac, created in 1987, is the most popular psychotropic drug in the United States. It's also used for OCD and eating disorders. SSRIs increase the availability of serotonin at the synapse by inhibiting reuptake, and have fewer side effects than tricyclics and are safer in overdose. They also have a more rapid onset and no cognitive impairments. Side effects include gastrointestinal problems, sexual dysfunction, headaches, and motor restlessness. They can cause serious problems in combination with tricyclics, MAOIs, antipsychotics, or anticonvulsants. MAOIs block enzymes that break down norep and serotonin, making them available at the synapse. MAOI medications include phenelzine, or Nardil, and tranylcypromine, or Parnate. They're recommended for atypical depression, and can help with increased appetite, hypersomnia, mood reactivity, rejection sensitivity, and accompanying anxiety. Side effects include hypotension, dizziness, dry mouth, nausea, weight gain, and blurred vision. More serious side effects include hypertensive crisis when taken with other drugs or food with the amino acid thyramine, such as beer, wine, cheese, liver, smoked meat, soup, soy sauce, sour cream, avocado, banana, plum, raisin, eggplant, spinach, tomato, and yogurt. Large overdoses of MAOIs can be fatal. Psychopharmacology, mood stabilizers, lithium, and anticonvulsants. Mood stabilizers include lithium, which is the treatment of choice for bipolar depression. Mood stabilizers reduce mania and level out mood swings, and are an adjunct treatment for schizophrenia, interexplosive, and episodic binge drinking. They may reduce postsynaptic responsivity to dopamine and norep. Side effects include gastric distress, weight gain, tremor, fatigue, and confusion. 35% of patients report tremor in the fingers. These drugs can be toxic or deadly in high doses. Some anticonvulsants, such as carbamazepine or Tegretol, are effective for mania, especially with rapid cycling, and they have a faster onset than lithium. Side effects include lethargy, tremor, ataxia, and visual disturbances. Valproxic acid has fewer side effects than Tegretol and lithium. Psychopharmacology, antipsychotics, neuroleptics, thorazine, Mellaril, Haldol, and Clozaril. Neuroleptics include thorazine, Mellaril, Haldol, and Clozaril. They are used to treat schizophrenia, mania, and psychotic symptoms. They are most effective for positive symptoms of schizophrenia. They work by blocking dopamine receptors in the brain. Side effects are anticholinergic, including dry mouth, blurred vision, tachycardia, and gastric problems. Extrapyramidal side effects include Parkinsonism, akathisia, dystopia, and tardive dyskinesia, a delayed effect occurring after 6 months of treatment. Symptoms decrease upon withdrawal. Clozaril is a newer drug and atypical, and is not associated with tardive dyskinesia or extrapyramidal side effects. Side effects of Clozaril include agranulocytosis, a decrease in white blood cells. Higher seizure rates are also reported, along with sedation and hypotension. Clozaril is effective with patients who are unresponsive to traditional antipsychotics. Psychopharmacology, sedatives, hypnotics, and anxiolytics. Benzodiazepines, barbiturates, and beta blockers. Benzodiazepines are the most widely prescribed anti-anxiety drugs, and include diazepam or Valium, alprazolam or Xanax, clonazepam or Klonopin, lorazepam or Ativan, and triazolam or Halcyon. They are used for GAD, panic and insomnia, alcohol withdrawal, and epilepsy. These medications enhance GABA, which inhibits the CNS. Side effects include drowsiness, sedation, weight gain, apathy, dry mouth, gastric problems, paradoxical excitation, motor issues, and sexual dysfunction. Anterograde amnesia is associated with the intravenous use of Valium and Ativan. They can be addictive and are fatal if mixed with alcohol or CNS depressants. Barbiturates include thiopental or pentothal, amibarbital or amytal, and secobarbital or seconal. They are generally not used because benzodiazepines are safer. Thiopental is a general anesthetic that interrupts impulses from the RAS. These drugs are addictive and are widely abused, and are the drug of choice for suicide. Beta blockers are traditionally used for hypertension and migraine. They are useful for anxieties related to public speaking or performance. They reduce HR, hyperventilation, and SNS activity. They are less effective for cognitive issues of anxiety. Side effects include bradycardia, hypotension, sexual dysfunction, fatigue, and paresthesia, and are more likely to cause memory impairment. An example is propranolol, also known as Inderal. Psychopharmacology. Other psychotropics. Psychostimulants. Narcotic analgesics. Psychostimulants mimic the actions of norep and dopamine in the brain. Examples are cocaine and amphetamines, Ritalin or methylphenidate, and Cylert or Pemeline, used to treat ADHD and narcolepsy. They decrease motor activity and impulsiveness. Side effects are decreased appetite, insomnia, stomach aches, dysphoria, OCD symptoms, and growth suppression. This can be reversed with drug holidays. They can also exacerbate facial tics. Narcotic analgesics include natural opioids, like opium, morphine, codeine, and their derivatives, including heroin, Percodan, Demerol, and methadone. These drugs bind to encephalin receptors and block